At Las Vegas Wisdom Teeth, we're committed to making this as easy a process and procedure for you as possible. There are 4 things you need to know before your appointment. First, we need you to arrive 30 to 40 minutes before the procedure. At this point, we will give you a pill that you can take that will help to smooth your transition into that sedated state and help make your visit more comfortable. Number 2, we need to make sure that you have nothing to eat for approximately 5 hours before your appointment. You can have clear liquids up until about an hour before your appointment, so be sure to stay well hydrated, but please don't eat anything for about 5 hours before. So if you have an afternoon appointment, you can have a breakfast. Just be conscientious about the time. We do need you to be fasted for about 5 hours beforehand. Number 3, we need to make sure that you have an escort. We need someone with you that's responsible, that's an adult, that can look after you, take care of you, someone who can drive you. We don't want you to drive for approximately 24 hours after the procedure. And any time that you're taking those pain medications that we prescribe, we need to make sure that you aren't driving or operating any machinery or equipment. The 4th thing that you need to be aware of is that the operatory will be a little cooler than what the temperature may be outside, so be sure to wear something comfortable and somewhat warm. However, I do need to make sure that you wear a short sleeve shirt because we need access to your hand and your arm through the procedure. When your room is all prepared, we will take you back to the surgical room where you'll be comfortably seated. You'll have a team of people around you, and at that point we'll connect you to a few monitors, so that's where that comes into where we have access to your arm or your hand. And at that point, we generally will start the IV. In your IV, we will then give you medications that help you to be extremely comfortable throughout the process. This is not a general anesthesia. The patient will be able to respond, or you'll be able to respond to instructions like turn to the left or turn to the right. However, the vast majority of our patients report that they remember coming to the office and they remember going home, and are very comfortable throughout that process. The actual wisdom teeth removal process only takes about 15 or 20 minutes. After that procedure is done, and as you're becoming more aware of your surroundings, we will place ice packs on your cheeks. It's important to keep those ice packs on for about 24 hours after the procedure. We want to make sure that those ice packs stay exactly where they need to be. They tend to sag a little bit, so it's important that throughout the day you continue to tie the tie up top so that it can hold those cheeks, kind of like a motorcycle helmet. We want to make sure that everything's nice and snug. The ice packs are Ziploc bags filled with ice. Periodically throughout the day, you may need to change out the ice, and so make sure that you stay up with that. We notice a tremendous difference in the patients who ice for the first 24 hours compared to those who don't. You will also have some gauze packs in the extraction sites on both sides of your mouth. Those gauze packs can be replaced as needed if you continue to have some oozing or some bleeding. Generally, by the time you get home, they're not needed anymore. You're able to take those out and discard those. However, if you notice throughout the day that you're still having some oozing or some bleeding, we'll send you home with some more of these gauze 4x4s. And so you'll fold these, get them moist, wring them out, and then place them gently over those extraction sites. Don't chew on them, but if you apply gentle pressure to that area, that usually helps everything to subside. If you continue to have some bleeding or are concerned with some oozing at the extraction sites, we also include in your kit some tea bags. You can take these out, and just like you would with the gauze, get them moist, wring them out, and then go ahead and just place that over the extraction site gently. In your post-operative goodie bag, we include 2 medications, Motrin and Tylenol. So with that Motrin or ibuprofen and the Tylenol, it's important that you take both of those together every 6 hours. In fact, you may want to set the alarm or timer on your phone so that this stays in your system for 3 days. These 2 medications together are much more effective than if they're taken by themselves. In addition to these 2 medications, we will give you a prescription for oxycodone. That oxycodone is for those times where you really aren't able to completely deal with these 2. Don't discontinue the Motrin and Tylenol. Take one of those oxycodone and take it on top of the Motrin and Tylenol that's going to be consistently in your system for the 3 days post-op. It may seem like a lot of medication, however, this is well within the safe dosage, and we have found that for our patients, it really helps the recovery time and recovery when they're able to stay on top or ahead of the pain curve rather than trying to catch up. Please note that post-op discomfort actually peaks about day 2. So if you had the procedure done on Friday, it may not start to peak until late Saturday night or early Sunday morning when you'll be sore. Make sure that you stay on those medications as best you can. One of the most common questions we get is, what can I eat? What can I drink? You can generally eat or drink more than you think you can. Soft foods, make sure they're soft, not overly hot, but we recommend scrambled eggs, oatmeal, macaroni and cheese, even a small sandwich if you were to cut it into small pieces, small bites. Those are certainly appropriate foods for helping your body to get the calories that you're going to need. In most cases, there are sutures present. Those sutures dissolve or come out on their own. As long as they're in for the first day or so, we're happy about that. It's very important that after the procedure, we don't use any tobacco products, no vaping, no cigarette smoke, no sucking through a straw. We don't want to rinse with any mouthwash. Those things will dissolve the blood clots that are formed in the extraction sites and can lead to longer post-op recovery times. So there are some things to expect. The oxycodone that we prescribe for some patients can cause nausea. And if that's the case, take the medication with a little bit of food. That tends to help. If you're still nauseated, maybe cut the pill in half, try a lower dose, or when you do take it, make sure that you sit still in a low light room, and generally that nausea will pass. Most everyone asks about this yucky taste that happens. That's normal. We're gonna get a yucky taste in our mouth for about a week after the extractions. It doesn't mean that there's an infection. It doesn't mean that there's anything wrong. We certainly expect that as your body is healing and going through this process, there's a yucky taste. With regards to that yucky taste, you can still brush as normal, floss as normal. Be really gentle around the extraction sites when you get to the very back of the teeth. However, one thing to avoid is any mouthwash. Anything that will dissolve the extraction site clots should be avoided. It's important that you're patient with the healing process. This is a very sensitive part of our body, and it will take a little time before you can open as wide as you used to and before you can get completely back to normal. This process has been undergone by many, many people who have gone through similar experiences, and just continue to be patient with that process. We want to make this recovery as smooth and as simple as possible. We want to make sure that this is an experience that you can refer your friends and relatives for something that was easier than you thought it was going to be. If you have any further questions or concerns, you can always refer to the information that we'll have available in your post-op and pre-op packet. Our number is always available. Please give us a call and come see us.